Hello and welcome to our DBT class. And for today's class, we'll be talking about how DBT can help with different kinds of disorders like anxiety and bipolar disorder. So let's start. So if we see, then there are different kinds of disorders. Like previously, we have already discussed about uh, depression and PTSD. And let's see that how today and anxiety disorders and bipolar disorder can actually help a person uh you know deal with deal with a person who can who's going through these kind of disorders and who has taken different kinds of therapies in DBT, okay, like mindfulness, etc. All right, so just for that, uh so now, as you can see, let's start with anxiety disorder and bipolar disorder. Okay, so first I'll be telling you about the different symptoms of anxiety disorder, and then let's talk about bipolar disorders. Okay, and then how DBT is helping with these two disorders. And in the next class, we'll be doing different kinds of disorders then. Okay. So if we talk about DBT and if we talk about if we talk about bipolar disorder, so then sorry, if we talk about anxiety disorder and bipolar disorder, so then anxiety disorder is nothing but excessive fear and worry, nervousness that interferes with our daily life. Okay, with the clinical, so how is it different from the normal stress? Because in normal stress it's like a momentary thing that's happening, right? It's just happening within the second, or it's just happening within uh some time. But the clinical anxiety that persists for a longer time. Okay, so uncontrollable anxiousness or uncontrollable fear, worry, nervousness, right? So that is something that is disproportionate also, because normally you will be okay, you'll be having stressful hormones, or then you'll be having stressful moments, and then suddenly you'll be okay, right? But when it comes to anxiety disorders, it is like a persistent and excessive fear and worry about things. So then when it comes to anxiety, there are different kinds of symptoms that a person has been going through. Okay, then only we have diagnosed them with anxiety disorder. So number one, first of all, let's talk about the emotional symptoms of the person. So emotional symptoms is the excessive worry, right? As we have already discussed. So constantly expecting the worst, okay, and even in the non-threatening situations. Then constantly overthinking, okay. So replaying past conversations or worrying about the future events, okay. This is constantly overthinking about मैंने ये कर लिया, मैंने वो कर लिया, शायद मैं ये बोल सकती थी, शायद मैं वो बोल सकती थी, शायद ऐसा हो सकता था, वैसा हो सकता था. Okay, then irritability. So easily agitated, easily short tempered. You will easily get angry. Okay, angry on certain things. Then restlessness, constantly touching something, constantly like just playing with your hands or your feet, or like constantly you just like doing certain things which is not helping you remove your anxiousness in any way. Then we have feeling of overwhelmed. Okay, so easily overstimulated by crowds or loud noises or responsibilities. Okay, so even when a person they go in a crowded situation, so even then they become anxious because there are so many stimuluses that they have to cater to. There are people, there is noise, there is ये वो कितनी चीज सारी चीजें हो रही है साथ साथ. फिर आता है unexplained fear. So anxiety without a clear cause. So often irrational or intense fear. ओके, मतलब अगर डर लगेगा तो किसी भी चीज से क्यों लग रहा है डर नहीं पता, बस लग रहा है डर, यू नो. सो या, दैट्स दैट. फिर है हमारे फिजिकल सिम्टम्स. ओके, सो फिजिकल सिम्टम्स में आते हैं हमारी पैल्पिटेशन. ओके, सो वी आर फीलिंग that our heartbeat is getting pumped up. Okay, feeling like the heart is racing or pounding, or it's just like धक 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 होती है ना, तो वो. बट वो धक धक जो मैं कह रही हूँ, इट इज नॉट अ मोमेंटरी थिंग, यू नो. इट्स हैपनिंग एंड इट्स नॉट हैपनिंग इन अ वेरी गुड वे. इट्स नॉट benefiting you in any way. Realize this, that the difference that I'm talking about in the dhak dhak before getting onto a stage and the heart racing, which is in a normal kind of a situation and for a longer time, you know, we should know, and we should cater to that as well. फिर है shortness of breath. So shortness of breath मतलब gasping for breath. You will not be able to get that breath, or you will not be able to catch that breath, or long sighs. जब ऑक्सीजन की कमी हो जाती है अपनी बॉडी में तो ऐसे होता है, राइट. So that, then hyperventilation, feeling suffocated, or difficulty in breathing also. All right. So that's that. Then sweating and trembling. Okay. So the sweaty palms जो होते हैं हमारे, and excessive sweating that the person is having, or trembling or shaking of the hands, feeling restless on their feet, so constantly like doing this with your feet. फिर आता है डिजीनेस, लाइट हेडेडनेस, राइट. सो फीलिंग लाइक ground is moving, or you're just about to faint. Everything is moving around you, you know, because when there is a lot of anxiety that a person has been going through, it is very difficult for a person to get through it. You know, of course, I'm not only saying there are physical problems, there is a behavioral problem, there are emotional problems, and